So right at the first week,
Yeah.
a lot of patients are like, oh my gosh, what have I done?
Yes.
What have I done
Yeah.
is what most people feel. And I actually tell them that during the preoperative visit of these are usually the emotional roller coasters people feel, especially after mommy makeover. And then by 1 month, people will be like, oh, I'm just so excited. I'm so happy.
Yeah.
And this is only going to get even better after the settling happens. And then by 3 months, people are overjoyed.
From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Today, I'm joined by Dr. Elise Min, a board-certified plastic surgeon who specializes in breast and body contouring. She's here to explain what a mommy makeover is and how it may help you achieve your body goals. Dr. Min, welcome to the Care Experts podcast. Thank you for being here today.
Thank you so much for having me. I'm excited to be here today.
So I can't wait to dive into this topic. I think people have a lot of questions about this. Today, we're going to talk all about mommy makeovers.
Yeah.
Can we just start off by really breaking down what is a mommy makeover?
Absolutely. So mommy makeover is sort of a coined term when we're doing surgeries both in the breast and torso. So it's not just for mommies. There are people who also have similar situations that would require a mommy makeover because it's somebody who needs both breast freshening up surgery as well as torso shaping.
What are the different procedures or surgeries that are included in a mommy makeover typically?
Yeah, so for the breast portions, it would include a breast lift or breast augmentation or a combination of both, which we call augmentation mastopexy. And then in terms of the bottom portion, we're frequently talking about an abdominoplasty, commonly called tummy tucks. And in addition to those two things, where we could be doing liposuction in the flanks, the love handles, and fat transferred to some parts of the breast. There are other extra things that can all add on to make things look even better. But generally, on the bottom portion, we're talking about tummy tucks.
Why do people typically get all of these done at the same time? You'd almost think that it would be better to stage them out a little bit.
That's a great question. A lot of the patients who prefer the first route of doing it all together is because everybody's so busy. And being a mom, and whether you're a stay-at-home mom or a working mom, you're just as equally busy in either situation. So people want to just have one post-op recovery and asking for the village to come help. It's hard to ask twice or multiple times. So I would say that's the main reason people would want to do it all at the same time. Now, that being said, there are groups where I would tell them it's best to kind of break it down. And that may be just sort of more individual sort of factors of anatomy or sort of social situation.
I see. And this is something that you would discuss with somebody in that initial consultation where you're going through the whole plan, their motivation, their driver, all of it.
Yes.
Yeah, amazing. So how long should somebody typically wait after having baby and breastfeeding before even considering something like this? Because obviously this is a huge life change. Our body is going through so much, and I can imagine it's not something that you want to rush into right afterwards.
Great question. If you had asked me that before I became a mom, I'd be like, oh, generally you want to wait at least 6 months. But now being a mom, I'm like, man, everybody's looking at my friends, even myself, just the changes we go through with our bodies is very different. And everybody's healing times is very different. I had some friends who, after having a child, they're like, I'm fitting back into my jeans 4 weeks after giving birth.
Right.
For me, it took a full year. So just being able to get back to a phase where you're not still actively losing weight, but things have sort of plateaued, that's where you want to get to undergo any kind of surgery of this caliber. And then because mommy makeovers also have a breast component to it, generally you want your milk to have dried up before undergoing the operation.
Okay.
Especially if we're considering putting implants in. So with that can really vary. I have a lot of patients even in my practice where they come, they're like, okay, I'm ready. And then I'm examining them and I see milk being produced. And I'm like, oh man, we got to wait a little longer. And that time really varies from patients who are like, oh, it's been 6 months since I last breastfed and they're all dry, to patients who are 2-3 years out of last breastfeeding session.
Yes. Yeah.
They're like, oh my gosh, I still have some. So long story kind of short, I would say it varies per individual.
Yeah.
Generally, once you've kind of plateaued in your active weight loss after giving birth is probably a good time to pursue the surgery.
Yeah.
There's also mental component for moms too. A lot of women after giving birth, there's a lot of postpartum just mood changes, and honestly, I wouldn't even call it a mood disorder, but just adjusting back to the norm of being oneself and not just a constant caregiver. And that takes some time for a lot of women as well, where they feel like, okay, I feel like I can finally think about me.
Yes.
And that also varies per each woman and individual thinking about the surgery.
Let's talk a little bit about the actual procedure day and when
Yes.
somebody comes in to do their mommy makeover. What does that look like?
So there are a lot of mixed emotions people are going through, especially in the morning of mommy makeovers, given the population that are going through the procedure. But after they've sort of, they meet me, we're like, all right, we got a plan. There's no new information being thrown at them.
Yes.
They've processed everything. And I also work with incredible team of anesthesiologists, scrub tech, circulating nurse, and it's an all-female team.
Oh,
So it's a vulnerable time for every patient coming through, and having sort of just warm people who also understand has helped my patients kind of get through that morning time of getting undressed. I'm marking them, and then we whisk them back to the operating room. And something I really cherish is before they go to sleep, before the medicine that puts them to sleep goes through their IV, I like to hold their hand and just remind them, hey, I'm here.
I love
And
that.
that just starts kind of a good vibe as they fall asleep.
Amazing.
Yes.
Are there any risks or contraindications that somebody listening should consider before doing a mommy makeover?
Yeah, absolutely. I would say with any kind of surgery, there are sort of common risks that are sort of common to particular operations.
Yeah.
So I'll first mention tummy tucks. So tummy tucks, we are essentially kind of flattening your abdominal wall that's now sort of stretched out from whether it's through weight loss or having carried pregnancy. So in those situations, if it's just the issue of stretched out abdominal wall, it's going to be tightened. I'm going to essentially tighten the abdominal wall muscles to make it flat again, and then remove the excess skin. There are some patients and people in general who have reasons to have pressure from the inside of the abdomen, just kind of punching against the repaired wall. So bloating, or people who have constipation issues, people who have chronic cough issues, people who have to sort of strain their abdomen even subconsciously for different reasons why they would have that. Those are patients who want to first consider getting those problems fixed before signing up for a tummy tuck, if they want to have more kind of ideal result of that sort of flat abdomen. Because otherwise, the surgical repair it can be permanent if followed with healthy lifestyles. But if it's followed with constant bloating, essentially think of something just kind of punching against the abdominal wall from the inside, then you might be more you might have a rounded, rotund sort of abdomen even with tummy tucks.
And for some women after pregnancy, they'll have what's called split abs, or DRA.
Yes.
Is that something that you're addressing in the mommy makeover?
Absolutely.
Yeah.
So every abdominoplasty, a tummy tuck, includes diastasis repair. So what that means is our six-pack muscles generally look like this before pregnancy.
Yes.
And then it expands as we have children. And then when it goes back, 95% of women, it generally kind of goes back with a little distance in between.
Yes, that's what happened to me.
Yeah, yes. And there's definitely truth in like, hey, if you go to the gym and work out, it can improve. I would agree can improve a little bit.
Yeah.
But to a certain extent, it never quite goes back to its location where it was before. And that's where a little help with surgery and suturing that closer together will help get rid of that gap in between. With 1 or 2 pregnancies, it may not even be a big problem for some, but there are other patients who've had multiple pregnancies, and it's just kind of getting wider and wider. When they're doing a sit-up, they're like, I see a dome. I see a
Yes.
pyramid between my abdomen, and that would most definitely impact people's self-confidence.
Yeah. Let's talk a little bit about who makes a good candidate for a mommy makeover. What are you looking for when somebody comes in to meet with you to determine whether or not they would be a good fit?
Absolutely. Just generally medically, that they're not somebody who has serious medical conditions.
Yes.
And if that's the case, we would get appropriate clearance from the specialists that are taking care of those issues for that patient. So once it's deemed you're physically healthy patient, it would be asking kind of what are your motivations of wanting the surgery, kind of getting a sense of, are you kind of at a place of zen, of wanting to undergo this for more self-confidence and feeling more like yourself from the past.
One thing we didn't talk about, could a breast lift be included in this as well? Does that fall into the same category?
Yes.
Yeah.
So
Okay.
portions of the breast surgeries, it really depends on what they come with and what sort of look they have that they want to correct. So for some patients that may not involve a lift, but a lot of people during mommy makeovers will need a little bit of lift. A lift is a procedure I would do in order to tighten up the breast envelope. So if
Okay.
it's too much skin, we're going to have to tighten it up.
Mm-hmm.
And with the augmentation, that fixes the deflation, the lack of volume. After having children, a lot of moms will feel like, oh my gosh, what I used to love about my breast, the fullness on the top poles
Yes.
have completely gone
Gone.
away. So for some women who naturally have large breasts, like D cups and up above, we can actually change that breast tissue and roll them up. I call it kind of doing an origami,
Yes.
3-dimensional origami into making perky breasts. But for women who've naturally had A cups, B cups, even small C cups before having children, they will notice, oh my gosh, I have nothing to
Yes.
move around.
Yeah.
Those are patients who would get a breast implant, the augmentation part of it,
Right.
and plus minus a breast lift.
Okay. They come in on that surgery day. The nerves are there. They undergo the surgery. How long does it take typically?
Yeah, that would vary depending on what portions of the surgeries are involved.
Of course.
So if it's a more involved breast surgery, it'll be a little bit longer. If it's just breast augmentation, it can be less than an hour, just addressing the breast
Really?
part and then doing the tummy tuck. So it gives a pretty wide, I would say, range of hours, between 4 hours to 8 hours of surgery,
Okay.
depending on what combination of operations are being put together.
Okay, amazing. And what does the recovery look like for this?
The recovery afterwards, I wouldn't lie, it's not the easiest. I would say abdominoplasty, the tummy tuck part, is the harder part.
Okay.
The tummy tuck, because we are tightening the abdomen, patients will be a little bit hunched over
Yes.
for at least the first sort of 1 week to 4 weeks, depending on how tight that closure is. And that can lead to a little bit more of like, oh, I'm not able to mobilize as easily as I can. So that, I would say, adds to that feeling of, oh my gosh, this is kind of a big recovery.
Yeah.
From a soreness, pain standpoint, it can be a little bit sore. Different surgeons will have different sort of things they use to help with the pain control.
So 2 to 4 weeks of recovery time. How long are people off of work or waiting before they do something like going back to the gym or working out?
Yeah, so for working out in gym, at least 4 weeks
Okay.
before they can do that. For work, I usually like to tell my patients at least take 1 week off. Depending on what sort of work people have, some people who have the chance of being able to work remotely, it's more laptop work, maybe just show up on a Zoom and
Yes.
then you can be in kind of your post-op gear. Then maybe even at second week, you could kind of force yourself into important meetings. But anybody who requires kind of extra lifting or a little bit more showing up, I would say maybe after 2 weeks, that could be possible. Week 3, week 4, it depends on the individual. Some people are a lot more like, okay, I can do this. And then for others, week 3, week 4, it might be a good idea to still kind of take it slow.
Yeah, it really is about listening to your body as you go through recovery and noticing how you're doing along the way.
Exactly.
For moms, we don't get a day off or time off. So what would you recommend for a mom are they typically kind of going to a hotel afterwards if possible, or taking some time off from lifting up their kids?
Yeah,
How do you recommend people navigate that?
in fact, that's such a great question. And that's another thing I actually add into what do I look for during initial consultation is making sure they understand the kind of support they will need
Yes.
afterwards. So it's at a time that they're thinking of within a calendar year that works for the whole family to help support the healing process. So from that perspective, right after the surgery, I usually send my patients to aftercare where there is one-on-one nursing. So you're away from your kids, so you can just kind of focus on yourself and you're
Yes.
not feeling guilty. So a lot of my patients will stay at least one night overnight.
Yeah.
Some will extend up to 2 nights overnights. And then they get to go home. And afterwards, they are generally getting a lot of help from a lot of people, whether it's their own moms, sisters, friends, spouses. So it does require extra help, especially in that first 1 to 2 weeks of people just kind of helping you out.
You really have to call in the support team on this one because it is a major surgery. So you want to have that village around you to make sure that you feel supported so that you can work on healing.
Most definitely. I would definitely say yes to mommy makeovers for you need a village to help
along the way.
Yes.
Let's talk about the results because this is the kind of fun, exciting part for anybody who's listening right now. How long does it generally take to see those final results?
Yeah, the results would start to show after the full swelling, what we call after the body has settled.
Yes.
And for most patients, 6 months would be sort of full resolution of all the swelling. After 1 month, patients will start saying, oh my gosh, I am so excited at what I'm looking at. By 3 months, I would say 90% of swelling has resolved. Okay. And then sort of the last 10% takes another 3 months before you feel like, okay, this is what I'm going to be like.
And how do patients generally react when you see them 6 months later or you see them at a follow-up? Are they generally feeling like a lot better about themselves, or what do you notice?
So right at the first week, a lot of patients are like, oh my gosh, what have I done? What have I done is what most people feel. And I actually tell them that during the preoperative visit of these are usually the emotional roller coasters people feel, especially after mommy makeover. And then by 1 month, people will be like, oh, I'm just so excited. I'm so happy. And this is only going to get even better after the settling happens. And then by 3 months, people are overjoyed. They have already forgotten that first week after. It's a bit like giving birth, you know, pregnancy, third trimester, especially 35 weeks and up, it's absolute horror. And then you're about 6 months after having your newborn. It's like, oh, I could see why people have
Should we have another?
Exactly. Yes.
All right. I've got some amazing Ask Me Anything questions from our audience for you. The first one is, how long does it take for my stomach muscles to heal after giving birth? Will I ever get that flat stomach again without surgery?
Great question. I think we've kind of touched upon that. It varies. I've seen patients where they've really gone hard on working out and their abdominal wall is muscular. When I feel for that rectus diastasis, I'm like, wow, it's really just about a centimeter and you really don't need to fix that. It looks great. Yeah. So there are patients who've achieved that. I would say that's maybe like 2% of my patient population. The rest, I think it's important to at least give it a shot. I think it's important to get an idea of how much healing can my own abdominal muscles have based on consistent workout. And then at some point, it'll be very obvious to the individual that actually I've hit a plateau. And that's where extra help would be needed. Yeah. And it also gives them a peace of mind that I tried my best and this is the logical next step.
Yes. If somebody's considering surgery just to address the abs separating, I wish more women knew that physical therapists, pelvic floor therapists, Kegels can help support. It's not necessarily going to fix it, as you said, and everybody's different, but it's a great starting point before surgery.
1000%. Yes.
Our next question here. If I have stretch marks, will a tummy tuck get rid of them or will they just move?
Great question. That's both yes and no. So it depends on the extent of stretch marks. So if your stretch marks is within my surgical markings of the
Yes.
tissue that's getting removed, that tissue is like say goodbye. Say your goodbyes the
They're
day
gone.
before, they will be gone. Now for some women, the stretch marks extend a little bit higher, a little bit above the belly button. Those are the extent of the stretch marks that will last. And then, yes, and they move. They move to the bottom of your abdomen after
Yes.
the tissue is pulled down. So that question is you're very astute in asking that. It's both yes and a no.
I feel like I got wider during my pregnancies and I want to slim down my overall shape. How can a mommy makeover help with this?
Great. So that would be somebody who probably will need some degree of liposuction at the same time as tummy tucks.
Yeah.
And it's also kind of genetics as to where you sort of add on the extra weight. So for this particular individual, it sounds like it might be more around sort of the hip area and maybe the flanks, what we call the love handles. Liposuction will help kind of narrow that and shape it nice in a way that they would want.
Amazing. Thank you so much for joining us today and for answering all my mommy makeover questions. You're such a wealth of knowledge.
Oh my gosh, it's been lovely. Thank you for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.